three words: discover new knowledge. New is the most important. So whenever you put out, you do research, you must be producing new knowledge. Okay? And the other objective is to test this new knowledge that you have discovered. Now, what is medical research? Medical research is simply research in the field of medicine. The general objective of research in medicine is we're trying to look for new knowledge and new tools, especially surgery tools, okay? To come up with skills or new technology, to come up with tools which can help us in our medical practice, the treatment of our patients. Now, why do medical research? Why is it important for us to do medical research? Primarily, it's a requirement of our profession. We doctors are considered scientists. You know, scientists should be researchers. So doctors must be researchers. Okay? So that's as simple as that. Now, second reason is that, there are a lot of things that are not absolute, which are relative in the field of medicine. What might be true today might not be true tomorrow. There are a lot of things we still don't know. So it is incumbent upon us as doctors, as physicians, as surgeons, if we want to improve the care of our patients, we should do research. We don't just follow the findings, just accept the findings of other researchers. As doctors, we have an obligation to the patients that we treat. So we should try to look for the answers of the problems of our own patients. Now the third reason is it is an important tool, important method or ways of a career growth. You want to be a improved, competent, or better known surgeon without some research. You know that in your bio data, they always ask for papers published. Papers published, number of papers written, number of papers published. Now, the basic medical research process of the research process starts with the doctor, with the physician, or the physician to be. Next would be, I'll just read the various steps of the research process, and I'll just explain one by one. So, on the doctor, we have the research topic, research question, and boxes. Then the research objectives, research methodology, implementation of the plan, interpretation and conclusion, writing of the paper, of the result, presenting the paper, and then publishing the paper. Okay. So one of the questions in the medical case report is that the medical case report will not be considered official until it is published. So the end point is publication. The starting point should be a motivated decision. Okay. So a basic medical research process should start with a physician who is motivated to do research. If you're not motivated to do research, I don't think you can do research. So what I'm doing now with my first 3 transparencies, I'm trying to motivate you to do research. So after you've been motivated to do research, then you think of a research project. And when you think of a research project, you start with a research topic, and then you go to a research question or hypothesis. Okay. Now, what is a research topic? Research topic is none other than broad subject matter. Example, you want to do a research on acute appendicitis. You want to do a research on the thyroid gland. You want to do a research on abdominal trauma. So that's a research topic. So after you have conceived, you have thought of a research topic, the next question is what about it? What about acute appendicitis? What is it, acute appendicitis, that you want to do research on? Okay. So you try to get to a more specific question. Okay. And that will become your research question or hypothesis. So if you put it in the form of a question, then that is a research question. An example, does leaving the wound open reduce the incidence of post-appendectomy infection? That's an example. Now another example, can you think of an example that you might want to do research on? Acute appendicitis. Analysis needed in the evaluation of patients with acute appendicitis. Plain X-ray, you want to study about the practice of other people who order to plain abdomen for patients with acute appendicitis. These are just examples. The questions that you pose, the specific questions that you pose would be your research question. Research question or hypothesis is more specific than research topic. It is actually the question that you want to answer, the problem that you want to solve, or an issue which you want to settle. The format will be a question. If it's a question, it's a research question. If it's in the form of a statement, it is a hypothesis. Now, in formulating a research question or hypothesis, you must be very specific. The research question or hypothesis must be simple, significant. Remember I mentioned in the definition of medical research, it should be something new. So one of the meanings of significant is something new and it will be useful. And one of the qualities is that it must be researchable. It can be solved by a research project. And then the other one is it is feasible and practical to perform. Considering your time, your resources, your facilities. You cannot do it without doing it. You don't have the resource. After the research, this is an example of a research question and a research hypothesis. Research question, as I said, you just put it in the form of a question. Does leaving the wound open after appendectomy reduce the incidence of wound infection? Now, research hypothesis, you formulate it in the form of a sentence. Leaving the wound open will reduce the incidence of post-appendectomy wound infection. Okay. Now, after the research question and hypothesis, next will be your research objectives. Now, research objectives are none other than outcomes you want to produce or to be achieved through your research project. Now, the research objectives is the steering wheel, the so-called steering wheel, because it gives direction of what you're going to do. consists of a general objective, which describes the general purpose of the study, and a specific objective which spell out the specific outcomes that you would expect from the study. And these research objectives are derived from the research question and hypothesis. Now, some tips here would be the research objectives must be specific, it must be clear with variables. When we say variables, what are the outcome variables, the factors in the study, and then it must be measurable. Okay? Not be very subjective, not be vague. Now, an example of a research objective based on the research question we just formulated regarding acute appendicitis. Example would be a general objective. In general, the objective can be put this way: to determine whether leaving the wound open will reduce the incidence of post-appendectomy wound infection. That's the general objective. The specific objectives can come with two statements. One, to compare the wound infection rate in wounds, or to compare infection rate in wounds that open with that of wounds closed primarily in patients operated for non-perforative acute appendicitis. Here you tend to be very specific. Okay? You now include a spatial group of patients, non-perforative acute appendicitis. Now, a second objective will be to compare, if there are patients with non-perforative acute appendicitis, the other category of patients will be those with perforative. So you can also study this other group of patients. So to compare the infection rate of wound left open with that of wound closed primarily in patients operated on for perforative acute appendicitis. You can see that they're very specific about the patients, the category of patients. One is perforative, the other one, and the so-called congested appendix.